Hi, Dr. Yass here. Today we're going to talk about the issue of balance of muscle. This is an issue that relates not only to the area of addressing pain, but it relates to the sense of general fitness, how well you're able to accomplish the functional tasks that you're trying to, and the essence of being able to optimize your function is really the resultant of not only having strong muscles, but balanced muscles. And this also relates to why, when the muscles are not balanced, they can lead to strain and eliciting of pain. So I want to talk about this issue of what you typically find with most people, where the imbalances lie, both in the upper body and the lower body, and then discuss how we could resolve it and discuss the types of issues you might anticipate if you are having a high level of imbalance. So when we're talking about the upper body, we're typically talking about a muscle imbalance that develops from the pec muscles, the chest muscles, the anterior deltoid, the front shoulder, and the bicep muscles, versus the muscles between the shoulder blades, which are known as the interscapular muscles, the back of the shoulder muscles, and the back of the arm muscles called the tricep muscles. What typically happens is that just as a result of normal actions and attempts to perform activities, we use the muscles in the front of our bodies. So there is a natural tendency to have stronger pecs, front shoulder, and bicep muscles. Now, that, as a general rule, can sustain without having symptoms. But if the imbalance becomes so great, the tendency is for the pec muscles to shorten severely. When they shorten severely because of their attachment to the shoulder, they will pull the shoulders forward, creating forward shoulder posture. It's a hunching or a rounding of the upper back. The reason this is important to understand is because when you round the shoulders, what you're seeing on the side, what's happening in the back of the body is you're actually having your shoulder blades move away from the spine. So rounded shoulder posture, which is the hunching posture, actually creates what's known as abduction, or moving away of the shoulder blade from the spine. This is critical to understand because there are muscles that actually attach from the shoulder blade to the spine, both in the thoracic spine and the cervical spine. So when we're talking about the muscles that attach from the upper inner shoulder blade to the cervical spine, we're talking about two muscles called the levator scapulars. These are so important to maintain at their optimal length because these are the muscles that actually are responsible for supporting your head. So if you were to create a rounded shoulder posture, which causes the shoulder blades to move farther away from the spine, you are elongating these muscles, the levator scapular muscles, these muscles that run from the upper inner portion of the shoulder blade to the upper cervical region. By elongating a muscle, it loses its ability to create force. Since the purpose of the levator scapulars are to support the head, and the weight of the head has not altered, by elongating the muscle, it loses its ability to support the head, therefore it strains. When it strains, it can elicit pain at the neck region, or it could even lead to headaches, migraine headaches. So what you see is that neck pain is actually the result, in many, if not most cases, of a muscle imbalance between the chest muscles, the front shoulder, and the bicep muscles versus the muscles between the shoulder blades, the back shoulder, and tricep muscles. So that is a common area where you might get pain as a result of achieving muscle balance or muscle imbalance. Now, here's the funny thing is that you do have these people who are out there, they're recognizing that fitness is a component of function. They want to get out and exercise. They go to the gym, maybe they get a personal trainer. And what are the muscles that are typically strengthened? The chest muscles and the bicep muscles. The very muscles that are too strong in relationship to the upper back muscles. So what's happening is that by strengthening the muscles, these muscles, you're actually feeding in to the imbalance that's leading to the potential for neck pain. And Also, causing these muscles by shortening your chest muscles and your biceps to lose their ability to create force and therefore make it harder for them to perform the activities you're trying to perform. So let's be very clear. This is a critical thing I want people to understand about exercise. Exercise is not arbitrary. When symptoms exist, certainly, we want to only be doing exercises that pertain to the very specific muscles that are responsible for the symptoms being experienced. So in this case, if we have a forward shoulder posture or a hunched posture, you would never want to strengthen the pecs or the biceps in the initial phase of your strengthening program. You would want to strengthen the muscles between the shoulder blades, the posterior shoulder muscles, the tricep muscles, the lower trap muscles, the lower trapezius muscles, and the rotator cuff muscles, all the muscles that run across the upper back. By doing this, we could create an opposing force to the chest and the bicep and the anterior shoulder muscles, which will help to pull the shoulders back, resolve the hunching posture, maintain the optimal muscles that support the head so that your head is supported with greater ease. It's maintained over the cervical spine so that the spine itself is supporting the head. And this allows for the decrease in chance of eliciting symptoms while also optimizing your ability to perform activities. Another place that you might see pain with this process is pain between the shoulder blades, because even the muscles that hold the shoulder blades against the rib cage, which happen to attach from the inside portion of the shoulder blade to the spine, have a tendency to become overstretched with rounded shoulder posture. So that's another place where you might find pain. Another place might be at the back of the shoulder itself, the shoulder blade, because the rotator cuff muscles work in conjunction with all these muscles. So you might end up having pain behind the shoulder, which is a result, again, of this imbalance developing. So the key imbalance that develops in the upper body is the chest, the anterior delt, and the bicep versus the muscles between the shoulder blades, the back shoulder, and tricep muscles. We want to try to make sure that we prevent this from happening. So if you're going to start an exercise program, we want to make sure that you've developed a tremendous amount of strength of the muscles between the shoulder blades, which are the rhomboids and mid-traps, the posterior delts, the triceps, the lower traps, the rotator cuff, and the, what other muscles? Locator cuff, the triceps, the post delts, the rotator cuff, the lower traps, and the interscapular muscles. Those are the ones we want to make sure are strong before you go out and then begin to try to strengthen your pecs and your biceps. Don't rush into that when you're starting an exercise program. Most likely, the imbalance exists. It might not be enough to elicit symptoms, but it's there. Let's try to work the upper back first. The other major imbalance that develops in the lower body is the front thigh muscles in relationship to the back thigh muscles. This is simply because when we're standing up or sitting down in a chair, when we're walking, when we're negotiating stairs, if we're kneeling down, we're always doing things in front of us. That means that our front thigh muscles or our quads are responsible for that. There's a tendency for the posterior thigh muscles, the hamstrings, to be weaker. If, in fact, the quads get too strong in relationship to the hamstrings, they will shorten. They can shorten at the knee side of the muscle, which will cause the kneecap to become compressed in the knee joint. So when you bend your knee, there's excessive compression of the kneecap in the joint, which leads to pain at the knee joint. Or the quad on the top side, where it attaches to the pelvis, can have a tendency to shorten as a result of an imbalance between the quads and the hamstrings. And this can cause the front of the pelvis to be pulled down, causing an excessive arching of the lower back, and that could lead to pain at the lower back. So in the vast number of people who have pain across the entire lower back, the reason for the lower back pain has nothing to do with the lower back area itself, nothing to do with the spine. It actually has to do with a muscle imbalance that's developed between the front thigh muscles, the quads, and the back thigh muscles, the hamstrings. Again, people going to the gym, I see it all the time. What do they get put on when they're being put through an exercise routine, or they decide to do on their own? Knee extension, which is a strengthening exercise for the quads, the leg press, which is another strengthening exercise for the quads, or they'll do that walking lunge, which is a terrible exercise. But the reality is everyone's doing quad exercises. No one's doing hamstring exercises. And then you wonder why you're having your pain at your back or your knee. And you think to yourself you're doing the right thing because you're exercising. But remember, the Yass method principle is that we want to only strengthen the appropriate muscles that either resolve symptoms or achieve optimal capacity of the muscles to create optimal function. So let's be very clear about this idea. Muscle imbalances are something that need to be addressed because they generally exist, but if taken to a high enough degree will lead to symptoms. We want to address this before we start any kind of generalized exercise program. We want to check and see if the quad is stronger. We want to make sure that the hamstring is addressed. If we see a rounded shoulder or a hunched posture, we want to strengthen the upper back first. If you want more information about this, if you feel that this is something that you're really not comfortable addressing on your own and you want to understand more, then just go to the website, www.mitchellyass.com, MITCHELLYASS.com. Just email me if you want at drmitch@mitchellyass.com. That's DRMITCH at MITCHELLYASS.com. You can call me on my cell phone, 516-449-1359. However you need to get in touch with us, we have the books out there, the Pain Cure RX and Overpower Pain. We do Skype evaluations. You can come to my office in St. Augustine, Florida. But regardless of how you get the information, you need the Yass method, because it's the only one that really understands the premises of muscle weakness, muscle imbalance, all these type things that could lead to symptom or dysfunction. And it is certainly the only method that has an understanding of what's causing pain in most cases, which is simply the fact you're trying to work against gravity to perform functional activities. If all the muscles aren't strong enough, or if they're imbalanced, that can lead to the inability of the muscles to perform the functional task, and that's what leads to symptoms. Again, the Yass method is the only standard that has this understanding, and if you want to get it, you need to get in touch with me or some of the information associated with the Yass method. So for now, this is Dr. Mitchell Yass saying bye-bye. Let's live pain-free and fully functional. So long.